Today I want to update you with the latest plans for our programme of test, track and trace. How we're going to use this massive testing capability that we've built in order to get R down and keep R down. Before I do that, I just want to remind you of what we're trying to achieve. Our plan is to slow the spread and to protect the NHS so that the NHS is always there for you and your family whenever you need it, whether for coronavirus or anything else. That goal is working. The number of spare critical care beds in the NHS is 3,413. On the latest figures, there have been 1,291,000 tests for coronavirus, including 85,186 tests on Sunday yesterday. 190,584 people have now tested positive for coronavirus, an increase of 3,985. 13,258 people are in hospital with coronavirus, and 28,734 people have died. That's across all settings, an increase of 288. That figure is lower than at any point since the end of March. But, as with testing, these reported figures tend to be lower over the weekend, so we do expect that number to rise. And remember, this is not just a number, but it is a constant, insistent reminder that we must go further and faster in our national effort in dealing with this virus. Over the last month, we've built a national testing infrastructure capable of over 100,000 tests a day. Today, the capacity stands at 108,000. This means we're now in a position to start implementing the next part of our plan, track and trace. The aim of test, track and trace is to hunt down and isolate the virus so it's unable to reproduce. And crucially, test, track and trace allows us to take a more targeted approach to lockdown while still safely containing the disease. Creating this system is a huge national undertaking of unprecedented scale and complexity. We've already taken Britain's small but brilliant diagnostics industry and taken it to global scale. We're building an army of human contact tracers who can man the phones and find the contacts and support people. And of course, we're developing the contact tracing app, which can help us deliver test, track and trace on the mass scale that we need across the country. The app, which takes full consideration of privacy and security, has already been tested in closed conditions at an RAF base, and today I can announce the next steps. From tomorrow, we will begin to pilot test, track and trace on the Isle of Wight, starting with health professionals and rolling out this week to all citizens. I'm grateful to the huge enthusiasm shown by islanders who know that by participating in this pilot, they're at the forefront of helping get Britain back on her feet. Where the Isle of Wight goes, Britain follows. The island has a single NHS trust, one local authority with the responsibilities for public health, a relatively low number of COVID cases, and because it's an island, we can run this trial in proper scientifically controlled conditions, comparing the effect with what's going on the mainland before we roll it out to the rest of the country. So here's how it'll work. Last week we put in place the testing capability on the island. From tonight, the contact tracing capability will go live, and then tomorrow, NHS staff on the island will be able to download the app. And from Thursday, each one of the 80,000 households on the island will get a letter from the chief nurse with comprehensive information about the trial. Islanders will then be asked to install the app. Once you've installed the app, it'll start logging the distance between your phone and other phones with an app nearby. It's been designed with a form of Bluetooth that conserves power so the app won't drain your battery, and this log of proximity information will then be securely stored on your phone. If you become unwell with COVID symptoms, you inform the NHS via the app. Other app users who you've had significant contact with in the last few days will then be sent an alert by the NHS along with advice about what to do. A test ordering function will then be built in. If you're watching this, you live on the Isle of Wight, I have a simple message. Please download the app to protect the NHS and save lives. By downloading the app, you're protecting your own health, you're protecting the health of your loved ones, and the health of your community. I know the people of the Isle of Wight will embrace this with enthusiasm because by embarking on this project and by embracing test, track and trace, you will be saving lives. The pilot is important so we can help make sure the app works as well as it possibly can alongside the contact tracing system. And with your help, we'll learn a lot, we'll use it to make things better, and we want to hear from you. I want to stress, and this is really important, that this trial does not mean the end of social distancing on the Isle of Wight or anywhere else for that matter. We will only change the social distancing rules once our 5 tests are met. So I'll end with the instruction that we all know. Please, stay at home, protect the NHS, and save lives. Or, if you live on the Isle of Wight, stay at home, install the app, protect the NHS, and save lives. I'll now turn to Professor Van Tam to take us through the day's charts. John.
Thank you, Secretary of State. So let's begin again with refreshing the 5 tests that we have in place for deciding if we're going to adjust the lockdown. The first is around NHS capacity, and we're in a good position on that one. The second one is about a sustained and consistent fall in daily deaths from coronavirus, and it is now very clear in the data that we are past the peak. The next one is solid information that the rate of infection is decreasing to manageable levels right across the board. This is an indicator that we need to keep a close eye on over the next few days and weeks. The fourth one is around operational challenges around testing and PPE and being able to meet future demand. There are continuing challenges on PPE. It is an absolute priority to continue pushing on this to get it right in the long run. But of course, on testing, as you've heard from the Secretary of State, we're in a very good position. And finally, we have to be confident that the adjustments we contemplate are not going to risk a second peak of infections. And this is really a matter of deep scientific discussion, very, very close following and absorbing of the evidence, and one that we're keeping under detailed scientific review as the days and weeks go by.
The answer is that test, track and trace will help us to get the R down and to get the number of new cases down and to keep it down, but not on its own. It's primarily the social distancing measures that we've taken so far that have flattened the curve, and now we can see that the curve is going down from the presentation that Professor Van Tam just gave. The goal is to keep the number of new infections going down and bring in the test, track and trace at a point which we will do from tomorrow in the Isle of Wight and then rolling out to the rest of the country. We will get those numbers down. The test, track and trace becomes more effective the lower the number, and then we want to keep the number going down by keeping the R below 1, the rate of infection. So it is not, our goal is not simply to flatten the curve, it is to get the occurrence of COVID-19 infections to very low levels, to be absolutely clear within your question that that is the answer. Thanks very much. We'll now take questions from the media. Hugh Pym from the BBC.
Thank you very much. When will you have recruited your 18,000 contact tracers, and when will the full test, track and trace network be up and running?
The aim is to have the whole thing up and running by the middle of this month. We're starting already. We've already started the recruitment. We have, of the 18,000, we have thousands already recruited, and we are making very rapid progress, not only in the recruitment, but also the training that's necessary, a short piece of training. And we have enough to get going on the Isle of Wight. In fact, they came on stream as of 5 o'clock this evening, so that's up and running now, and then to roll out across the country. But there's no magic around the 18,000 figure. That is the initial scale that we think is necessary. If it needs to be bigger, when we find out from the ONS survey that's in the field at the moment what the prevalence of the disease is, the number of new cases per day actually out there rather than that we find through positive tests, then we'll adjust that figure. That's the initial goal, but it'll be up and running by the middle of the month.